The role of private and mission health facilities in the plan and how public health facilities will get the biggest share of allocation. And Madam CS and your team, from previous engagement, I think 2 weeks ago with NHIF, we realized that the biggest, almost 70% of the money that we are giving to NHIF is going to the private facilities. And why? Because people are going to the private facilities because that's where they can get good health care and good services. Which plan do we have to revert for these services to be given by the public sector and to ensure that 70% will go to the public facilities vis-a-vis the amount of money and billions of money that is currently going to the private facilities. At the same time, on the same breath, Madam of health in this nation. And I think we have tabled a report in Parliament that is yet to be debated hopefully by next week. We had a petition from the COFEC on some charges that were charging a patient who was admitted for less than 12 hours and over 900,000 by a facility in this nation. We were shocked, Madam CS, when we went through the guidelines given by one of your agencies, the Kenya Medical Protection and Statistics Board. The reviewed guidelines of 2016 are ridiculous. So part of a lot of money that is in NHIF, it is being paid to the private facilities, but the cost, it is too high, and very few Kenyans can afford. Actually, I know there's going to be a lot of debate within the health sector because our recommendation was that we revert to the 2006 guidelines so that we allow the Kenya Medical Dentist Practitioners Board to fast track the review of the guidelines. But I'm serious, just to give you an example. In 2006, I think the amount of money that was given for cesarean section, that is the charges the doctors charge, was 40,000. But currently, they have given guidelines for the cesarean section, a minimum to be charged at 90,000 and a maximum of 180,000. I know majority of the people here are doctors, and surely for a C-section, why would you see a minimum of 90,000 and a maximum of 180? So the cost of healthcare in Kenya, as we looked towards the UHC, we must address it quickly, so that as we invest, as the government invests in healthcare, we are sure that the amount of money that we have now, we might not even need to increase more if we work on the cost of healthcare. We also needed to know how the various packages, including Linda Mama, funds for the elderly, and indigents and school-going children will be collapsed into one package, and specific legislative and regulatory proposals that we as Parliament would be required to support you, and so that we can fast track. We're going on recess from 6th, and so if there's a need of any amendments, any laws that need to be done, would be quick to assist and would want, even when we are at recess, to help in this. And so, Madam CS, we also want to know the role of KEMSA. I know you've said you're going to be to deliver the pharmaceuticals and non-farm. We would want that. We hope that, as per the request from the counties, then we'll be able to get the data on the disease. So even the data that is collected by NHIF, we are hoping we will have a lot of information. We noticed earlier that a lot of records that was made, it was data 2014, and there was nothing that was very recent. So the budget plan, by next year we start working on our budget. What kind of budget are we looking for? And this is a plan up to, we've said up to 2022. How many partners do we have? How much of their money have they committed to us? And of course then, Madam CS, on the Health Act, I know it was to be fully operational. How far have we gone towards spending, and what is our role, and how can we work between our budget? Of course then, my to the county, to the council. We as a National Assembly, we are involved in making. We have the senators who oversight you. Kindly, as you roll out these pilot programs, and I also request the ministry, involve all the political leaders. You need political goodwill. Let it not be the governor to implement with the MCAs and the CECs. Kindly invite your MPs, invite your senators, your women reps. Let it be concerted efforts. We would like everybody to be involved in political work, and that is our request this presentation. And my members are here and waiting. We'll be able to have many of those questions. And I want to thank you once again. Thank you, the UHC team, for thank you, the from the Ministry of Health, the NCS and the PS. And I want to thank the government for being and for this one. You know.